Dexamethasone, a steroid drug, has been in the news lately. We use it for inflammatory diseases including multiple sclerosis, asthma, and arthritis. Now, there is evidence that it might be helpful in the fight against coronavirus infection. It does not prevent infection, but it can reduce rate of death in people who are very sick. The study comes from a trial based in the UK called Recovery Trial. 2,104 patients either on a ventilation or on supplemental oxygen were given 6 mg dexamethasone daily for 10 days. Comparing them with 4,321 patients without treatment, the death rates definitely decreased with dexamethasone. The 28-day mortality for patients on ventilation with standard of care was 41%, and dexamethasone treatment decreased that to 27%. For patients receiving supplemental oxygen, the 28-day mortality was 25%, which decreased to 20%. In the 28-day mortality for patients with no respiratory distress, the 28-day mortality was 13%, and dexamethasone had no effect on people who did not have respiratory failure. So based on the data, we can conclude that dexamethasone can be useful for severely sick patients. The challenge with coronavirus infection is cytokine storm, which is the overreaction of the immune system that causes the lungs to fill with liquid and triggers acute respiratory distress syndrome, also called ARDS, in which patients drown in their own fluid. That causes damage to the organ system, which leads to death. And steroids are already used in hospitals to control inflammations. Steroids are also a cheap medication with proven side effects. Right now, we do not have effective treatment against coronavirus. We also do not have effective vaccine. And any drug or intervention is better than nothing. But until we develop vaccine, public health measures will continue to be important. Washing hands, wearing a mask, maintaining social distance. These are small things that we can all do to be safe. Thanks for watching Sahil. Leave us a comment and subscribe to our channel for new content.